there is so many more forms of diabetes than just type 1 or type 2 diabetes. In this video, I'm going to give you a quick overview about all the diabetes types I know about so that you don't get the wrong diagnosis and you have the possibility to treat your diabetes the right way. Down below in the video description, you find the timestamps to all different types of diabetes I'm going to cover in this video so that you can jump right to where you want to be. What all types of diabetes have in common is high glucose levels. The reasons for these high glucose levels are super different. So let's dive in with the first type of diabetes, which is the most common type of diabetes, type 2 diabetes. Type 2 diabetes is mostly diagnosed in older people, but there is also a possibility to get type 2 diabetes at any age. It's mostly caused by bad lifestyle habits, not the right nutrition over years, and not the right amount of movement over the years. That will lead to insulin resistance and in the end to a lower insulin production so that the body cannot keep up with the insulin need anymore, and eventually the blood sugar levels rise. You might have also read or heard about prediabetes already, which is the form of type 2 diabetes before you get it. Your blood glucose levels are not as high as you have it when you get type 2 diabetes diagnosed, but they're also not in the normal range anymore. Next type of diabetes is type 1 diabetes. People who get type 1 diabetes are mostly diagnosed with it in very young age. I have type 1 diabetes and I was diagnosed in the age of 9 years old, and that's very common. But you can also get type 1 diabetes in rare forms in older age. The problem about type 1 diabetes is that the body, for a reason which is not clear yet, destroys the insulin producing cells in your body, in your pancreas. That means that your body just does not produce any insulin anymore, which makes the glucose levels rise. And without injections of insulin, type 1 diabetics are simply not able to survive. Next is latent autoimmune diabetes in adults. I hope I pronounced it right. It's a hard word for me. In short, it's called LADA-Diabetes. LADA-Diabetes is type 1 diabetes, basically, which is diagnosed in older age. But there's one thing which makes it different from type 1 diabetes, which is diagnosed in younger age. The difference is that it is kind of a mix of type 2 diabetes and type 1 diabetes. People with LADA diabetes also have metabolic issues, like a lot of type 2 diabetics also have. So sometimes you need to treat it with insulin, but sometimes also lifestyle change is enough. Gestational diabetes is the next one we want to cover. That's a diabetes form women get when they are pregnant. And it's also that diabetes form which usually disappears again after having the baby. The problem is this: while being pregnant, the hormone balance is changing a lot. And the need for insulin is also rising. And if the body can't keep up with that need of insulin, your blood sugar is going to rise, and it's rising so much that it can be dangerous for the baby and for the mom. The reason for this is also, like type 2 diabetes, lifestyle issues. If you eat right, if you move more, you are probably able to treat gestational diabetes just like that. In other times, insulin injections are needed. And next, there is type 3 diabetes, which is basically a term for all of the other rare occurring diabetes forms, which I cover next. Maturity onset diabetes of the young, in short, MODY-Diabetes, is one of those. Researchers know 14 different forms of this MODY-Diabetes so far, and they constantly find new ones. Looking a couple years again and they have more. The problem about all of those MODY-Diabetes forms is that one specific genetic defect is there, and all of them are causing a problem in producing insulin so that your blood sugar is rising. The treatment of those different MODY forms is different, so make sure to know which form of MODY-Diabetes you have so you can treat it the right way. A lot of people are actually diagnosed wrong first and become diagnosed type 1 or type 2 diabetes before they know or the doctor realizes that something is not very normal. So definitely make sure to check out MODY-Diabetes if you have the feeling that your diabetes form, the way it behaves and stuff, does not really fit to the normal picture. And there's a lot of other diabetes types that are caused by genetic issues. There's so many that I can't go into detail about all of them, so I'm just gonna show them here. Then there's diabetes types that are caused by diseases in the pancreas. The pancreas is that organ that produces insulin, and if there's something wrong with it, of course, the insulin production is stopping or is not very effective anymore. So what can that be? That can be from accidents, from injuries on your pancreas, that it's not working right anymore. It can be other reasons, for example, cancer in the pancreas, or so many other things which I again show here. And one thing here is very important for me to mention. If there's any problem with your pancreas and the doctor is saying it's better to take the pancreas out of your body, be aware or tell your doctor that there might be a chance, or ask him if there is any chance to save the insulin producing cells in your pancreas, because there is the possibility nowadays to do that. Probably just specific hospitals which you have to drive a long time for, but if you can save, or if your doctor can save these insulin producing cells and transplant them back into your body, they will keep up with the insulin production after that operation, after taking the pancreas out, and that will prevent you from so many issues in the future. You're not becoming like me, like a type 1 diabetic who has to inject all the time. Instead, your body is still able to keep up with the insulin production to a pretty good amount. Probably not to the whole, like, normal amount. Maybe you have to do some insulin injections, but it's a good way to live the rest of your life with a way better glucose metabolism. Then there is diabetes types that are caused by infections. We don't know a whole lot about it, but we know that there is a bigger chance if things appear, like if a baby has in the first 6 months of living a respiratory tract infection. I hate that word. You know what I mean? Then the risk is higher for the baby to develop later in life a type 1 diabetes. Then there's other infections which will increase the risk for any type of diabetes, also type 2 diabetes, for example, in later life. All of those infections, we think this happens. We are not sure yet, but we think this happens, and I'm going to list right here now. Diabetes can also be caused from medications. And again, we're nowhere near knowing everything about this, but we know that these medications, which I list here, can increase the risk for developing diabetes. Diabetes can also be caused by problems in the hormonal system. There's so many factors that cause a higher or lower blood sugar level, and there are so many hormones that have an effect on this, which will lead to either a stronger insulin resistance, to a decreased insulin production, or even to more sugar released from the liver, for example. Here I'm going to show you hormonal disbalances which can lead to types of diabetes. And I'm not always talking about that those hormonal or other reasons for diabetes lead to any specific type of diabetes, type 1 or type 2 diabetes. These disbalances or problems, if it's caused by infections, if it's caused by hormonal imbalances or any other thing, might lead to a very, very rare form of diabetes, which needs a very different treatment form than type 1 or type 2 diabetes. So you need a very individual treatment plan, which you figure out with your doctor. I did not answer the specific questions you had about your diabetes form. Please let me know in the comments below, and I'm going to come back to you as soon as I can. Maybe you were also hoping to find more information about the new classification of diabetes types. Maybe you heard of it. There is 5 forms of diabetes which researchers recommend to use from now on. I'm going to show them here. And I definitely want to make a video about those in the future. It's very interesting. I'm just going to leave it like that. Make sure to like this video if it was helpful for you, and subscribe to my channel so that you don't miss out on my next videos. Thank you so much for watching and see you next time.